Welcome to the Hero Podcast. I am your host, Dr. Jermaine Ware from Hero Chiropractic. I wanted to share with you two case studies. I like to bring, clinical case studies every so often, present those so people can have a better idea of what's happening with chiropractic. This first one is edema and low back pain in pregnancy. So it goes as the following. A 28-year-old mom-to-be, pregnant for 33 weeks, presented at a chiropractic office. Her chief complaint was tingling and numbness in the second through fourth fingers on her right hand. She also reported low back pain and right leg swelling. She had endometriosis, ovarian cyst, and previously had 2 miscarriages. She was scheduled for 9 visits of care, and within that period of time, she did receive chiropractic adjustments, and all of her complaints within that time frame had resolved. It lends to some of the work that chiropractic is actually doing with people. And I myself work with a lot of pregnant women, helping them with their lower back pain, helping them after they've had the baby, with the breastfeeding pain in upper back and neck. Specific things I do. I've learned the Webster technique. I've done specialized training with pregnancy. So I've been working with pregnant women for a while, and there's a lot of different factors that come into it. And a lot of chiropractors don't work with pregnant women because they may not have had that training or may not have been privy to those special needs of a pregnant woman. The second one that I wanted to give you was chiropractic and exercise for fibromyalgia. So in this particular case, 55 women with fibromyalgia, aged 21 to 59 years old, were divided into 2 groups. Some completed resistance training, and the others received chiropractic adjustments in addition to resistance training. The patients who received chiropractic care were more likely to follow the exercise program consistently and had more significant improvements in functionality, balance, flexibility, and endurance. This study confirms the power of exercise and resistance training to ease the pain of fibromyalgia. In addition, at the same time, it demonstrates that combining chiropractic adjustments and exercise may enhance the benefits of both treatments. So, something to keep in mind. I know a lot of people see fibromyalgia ads from pharmaceutical companies on television all the time. And something that you may want to keep in mind is that there are other ways to address your fibromyalgia without the laundry list of side effects that you find in pharmaceutical drugs. Something to keep in mind. There's natural methods to handle fibromyalgia. And switching gears a little bit, we recently released our newsletter, 11 Ways to Lose Weight Without Diet and Exercising. We recently released that. If you didn't get a copy, you can stop by the office and get a copy or email us and we will send you a copy. But something else I wanted to share was a sneaky little trick that you can use to actually lose weight. So Japanese National Food Research Institute did a study and discovered that people who compared equal amounts of sliced and whole vegetables rated the sliced piles up to 27% larger. So they felt like there was more there when it was all sliced up. So apparently when you slice things up, people believe they're eating more food. But people actually trick themselves into feeling more satisfied with fewer calories. So that is something to keep in mind when it comes to eating your food. Make sure you cut it up. Feel like you're eating more. That's a trick I think people use when they are at restaurants and you have to have a small plate when it comes to like buffets, and you keep going back and keep going back. You don't put a lot on your plate, you just keep going back. So it's one of those ways to discourage those who are big eaters. May your troubles be less, may your blessings be more, and may nothing but happiness come through your door. That's an old Irish saying. And until next time, enjoy yourself, be blessed. I look forward to hearing from you.